In overnight news, I can confirm that we've only had one new case. This is a 20-year-old male. He is in quarantine. He's from Bellbird Park. And I just want to stress to everyone that he is believed to have been a close contact of people who went to the Korean restaurant in Sunnybank on the 23rd of July. So it's very important that if anyone else was at that Korean restaurant, the Ma Tong San Korean restaurant in Sunnybank, if you have any concerns, if you are feeling the slightest bit unwell, you must go and get tested. We still have 11 active cases, and I can confirm in the last 24 hours we have had 9,076 tests that have been conducted. And can I say from the outset, I want to thank everyone who has gone and had a test. Now, there will be delays, there will be queues, and I ask people to be patient. But this is a wonderful response. This is exactly the response that we need for people to come and get tested. And we're not out of the woods yet. We're going to keep a very close eye on what's happening, especially over the next few days. But the response has been terrific. And I want to thank all Queenslanders for doing that. But of course, this is a very serious situation. And of course, over the weekend, I want Queenslanders to really think about social distancing. Really, really think about social distancing. Keep up the good hand hygiene. It is absolutely important. The other thing that I want to mention today too is, of course, from 1 a.m. tomorrow, Greater Sydney is a COVID hotspot. There will be delays at the border. So think about your travel plans and think about where you need to go and think about the timing of those journeys. I'm not making any apologies for those delays because our police have a very important job to do, and I want to thank everybody for the work that they are doing on our borders to keep Queenslanders safe. There is nothing more important during this time. So the Police Commissioner and the Deputy Commissioner will address this issue. So I'm very, very comfortable with the rapid response that has been taking place in relation to these girls returning from Melbourne via Sydney, and the rapid response that has been put in place by health and the police is outstanding. And I want to pay a big public thank you to everybody who has been involved in that effort. But it is also very important, if you are sick, to stay at home and get tested. Any symptoms whatsoever, we want people to do the right thing. And like I said yesterday, if you're going into a crowded venue, you need to make sure that you social distance or you leave if you do not think that social distancing is being adhered to. Now is not the time for complacency. Complacency is our enemy. So do the right thing. And if you see someone not doing the right thing, call them out. I do. So make sure that you do the right thing and we'll get through this together. I'll hand over to the Deputy Premier, and the Chief Health Officer will give a more detailed explanation about that man from Bellbird Park. Thanks, DP.
The new case reported today brings Queensland's total number of COVID-19 cases to 1,083. 11 of them remain active. 5 are in hospital. We broke records yesterday in Queensland for our level of testing. 9,076 tests, 7,627 Queenslanders. Of those tests, 726 were in the West Moreton HHS, 2,498 in Metro South HHS, the largest focus of this effort, and 1,428 in the Metro North HHS. The new case today is a 27-year-old male from Bellbird Park. He's related to a person who went to the Mad Tong San restaurant in Sunnybank on the 23rd of July, and that is considered the most likely source of the infection. It underlines just how critical our contact tracing efforts are, and more than 1,500 contacts have now been traced related to these 3 cases. It also underlines how important it is for restaurants to keep a record of their patrons. Those records are incredibly important. They allow us to contact people quickly who may have been exposed to the disease. It also underlines how important it is that everybody checks that list of places where we think people who've been infected have been. That list is a source for information so that you can know if you have potentially been exposed. And if you see that list, if you know of anyone who's likely to have been to those locations, please alert them to it. Last night, Queensland Health issued a list of restricted suburbs, and I understand that it has been circulating on social media. I'd like to emphasise that list of restricted suburbs, the only new restrictions that apply to those suburbs are to aged care facilities in those locations. There are no other additional new restrictions there. As I said, record levels of testing, but in some cases that has overwhelmed our fever clinics. We want to thank everybody who has got tested. We want to thank them for their patience, apologise for the delays where they have occurred. Testing is incredibly important. I want to assure Queenslanders that I've asked Queensland Health and the affected HHSs to do everything that they can to ramp up testing capacity, to improve queue management, to ensure that people get tested as quickly and as conveniently as possible. On the Queensland Health website, there is a page where you can put your postcode in and get a list of locations where you can be tested. Our fever clinics are not the only options. You can also be tested at a range of other healthcare providers, including our fantastic private pathology services, QML and SNP, and I'd like to thank them for their work assisting us to do those tests. And finally, today is the day that Queenslanders who are currently in Sydney and who would like to return without going into quarantine must return. So it's a message to anyone currently in Sydney who is a Queensland resident and who would like to return without having to go into hotel quarantine. Today is the day that you must come home.
So one new case overnight, a 27-year-old gentleman who lives in Bellbird Park, who at this stage, I believe, contracted the infection from a relative. We still need to confirm those details, and we'll be working through all the contact tracing related to him. But at this stage, we know that one of his relatives, who may be the source of the infection, works at the Bolton Clark Aged Care Facility in Pinjarra Hills, a very good facility. They already had very good COVID-safe plans, and they've put them into action this morning just in case we do find out that that person who works there is the source of infection. That's in case any relatives who have their relatives in that aged care facility hear of anything. So that's a very important, very rapid response, and that aged care facility has done a very, very good job already this morning. So it is really important that all of us consider the three things that we each need to do to keep ourselves, our families and our community safe. If we have any symptoms, no matter how mild, to stay home and get immediately tested. Secondly, to at all times maintain social distancing and wash your hands. And thirdly, to reconsider the need to travel to either New South Wales, Victoria or overseas. If we all do those things, we can keep ourselves, our families, our communities as safe as we possibly can. Now, I do ask that people keep an eye out on our website in case we do need to announce more places now that we're contact tracing this new case who lives in Bellbird Park. We do believe, as I said, that he contracted the infection from one of his relatives who attended that restaurant in Sunnybank on the 23rd of July, which was one of those venues that the first case who went down to Melbourne attended. So we're fairly comfortable that that's probably where he's got it, but we will do contact tracing for him now as to who he might have come into contact with. Thank you.
Thank you and good morning, everyone. From the very outset, I would like to thank all of the community for your patience and really high level of compliance generally. This has been truly incredible and held us in good stead. Queensland Health, as you know, has put enormous resources into establishing these fever clinics, and we have been providing additional support in terms of traffic management as well as policing and obviously walking some of those lines that were there for an extended period yesterday. So can I please ask that people are very, very patient. Today we will continue with that traffic management. We will have additional police liaison officers and police actually walking up and down those lines. We haven't had an incident there yesterday, and that really is because people were getting impatient. So please be patient. I know it will take a while, but as I said and will continually say, this has held us in good stead as a result. The investigation into the 3 women that have returned from Victoria into Queensland has obviously resulted in charges. They will appear in the Brisbane Magistrates Court on the 28th of September, and this obviously is for providing false information and fraud charges. I want to make some comments about what's taking place in the community. We have seen community members making comments about certain cultural groups and ethnicities. This is not productive at all. People doing the wrong thing come from all walks of life, backgrounds and community groups. So it is important, especially in these times, that community groups actually come together rather than fracture. Police have so far issued 16 infringement notices to various people who have not complied with the Queensland Border Direction. And for example, yesterday an individual in central Queensland provided false information and was issued with an infringement notice. And there was a further incident overnight at Gold Coast border where a person was issued with a $4,000 fine for attempting to enter Queensland unlawfully. So police will continue to obviously issue these infringement notices for people who willfully and recklessly do the wrong thing. And today we have issued 2,169 infringement notices. The Deputy Commissioner will comment on the sheer number of people that we have processed with other departments, both at the road borders as well as the air borders. It has been substantial and absolutely sterling effort by all of those involved. We, as you know, have a new border system coming in from 1 a.m. tomorrow as Greater Sydney is declared a hotspot. So whenever a new direction does come in, there will be delays. So the message from all of us, as always, is please be patient. Plan your trip, and planning your trip actually means giving yourself a little bit more time. Ultimately, it is the safety of the community involved here, and we will be taking our time, if need be, to process everyone that comes through our borders. As always, and I think we all always end on this message, social distancing, good hygiene is paramount, and if you are unwell, please stay home and get tested. Thank you.
Good morning. May I start with the investigation that the Commissioner just spoke about, and just assure everyone that we have concluded our inquiries in relation to the breaches of our border by these 3 individuals. We have high confidence that we've been able to identify all the information that we need to be able to trace where these young women have gone. And you've heard this morning from Health about some of the things that are in place in terms of how we're trying to deal with that. So we're very comfortable with that. Obviously the charges for very serious offences are now a matter for a court to be considering when they appear in September. Can I talk about the 3 areas that the Commissioner just alluded to, and starting with our borders? The borders have been a very effective mechanism for us, and it's important to remember that since we started the border controls back in March, that over 500,000 vehicles at our road borders have now been checked. 11,312 people have been put into quarantine coming from overseas. And since we've gone to open borders on the since we've gone to hotel quarantine in Queensland for people domestically coming from hotspots around the country, we have put 1,507 people into hotel quarantine to try and keep our community safe. You would hear from the Chief Health Officer when she's talked about new infections over the past few weeks that the predominant number of those people have been in quarantine. So clearly our quarantine and borders have been working in keeping our community safe. The numbers are quite staggering. We've already hit 100,000 people since the 10th of July being checked at our domestic airports. We're expecting around 8,000 people coming into Brisbane today from interstate. Obviously, a number of Queenslanders wanting to come back home before the restrictions come into effect tomorrow morning. And we are in a position to be able to process them very effectively. So our borders are working, and I've listened with interest to some of the suggestions that are coming out there around what we should consider in terms of how we do our borders. We're very interested for the ideas that come out of our community. Can I give everyone assurance that we have thought about all of these extensively? We have tested the things that we need to do, and within the current legal and other operational restraints we have, we are operating on the best system. But we continually review it and we can continually adjust it. And certainly those people that are coming out of the Greater Sydney hotspot that have a border declaration pass will be getting push notifications telling them that there's changed circumstances and they need to update their passes. That's just an example of some of the things we've done to try and streamline the system. So high confidence there, we're able to meet that, and as you've heard from the Commissioner, we're still detecting people trying to get through the system falsely, and we'll continue to do that. With respect to our rapid response, of course, that's the third tier of our protection, so if people do get through that system, we're able to rapidly identify them and then test and quarantine those people in the community that need to do that. And that's unfolding as we see that. And I just want to finish off with the second part, which I've referred to a number of times, which is the social distancing, the second tier protection that we have in this state. That's the really important one that I'd really like our community to think about, because that's the one that our community can do the most about. So how we obey the social distancing, the personal hygiene that we do, staying home when we're sick. And as we're coming into a weekend, please remember that if you're thinking of going out and about in the community, that we'll be out there again, checking licensed premises, making sure people are abiding by the distances that they need to, the 1.5 metres and the other rules that we have in place, and making sure that everyone's doing the right thing. Because this is really about making sure that if anyone gets into our community with COVID, that we can limit its spread. Thank you very much. Yeah, sure.
Do you have any numbers on how many people have been coming into Queensland from Sydney and South last week?
What I can tell you, but we don't keep specific numbers for each area, but we do keep numbers of people who have been turned around. So since the 10th of July, at our borders, road borders that is, 2,593 people have been turned around. So they would be from hotspots both in Victoria and Sydney. And at our domestic ones, if I can just find the right place, we have turned around 49 passengers, so refused entry for 49 passengers.
I guess what I mean is with the 1am set date on Sunday, a lot of people trying to get back into Queensland for that conscious adjustment.
Yes, that's what I was talking about when I said the 8,000 passengers expected today. That's a lot more than we would normally see, so this is clearly people coming back from Sydney. So we're ready for that.
All roads into Queensland being manned 24/7. Are you hearing any reports of people trying to slip through country roads?
Look, we've had various reports from time to time, but we've got systems in place for all of those. They're not staffed 24/7 necessarily way out in the remote parts of Queensland. There's very small backtracks, but what we have got is patrols in those areas and police doing intercepts of people that are in that area to check whether they've come across or not.
Just for the Health Minister, you praised the rapid response, but yesterday we had people waiting for 7 hours, collapsing. Even when they got to the front of the queue, I think they'd put their name down and not actually get a test. Are you happy with that? Is that acceptable? And are you doing anything today, rolling out more centres?
Look, as I said, it's not good enough. We do want to test people fast and conveniently, and that's why there were urgent meetings yesterday between Queensland Health, those health services and other healthcare providers, and those discussions continue today. I expect they'll be better today. There is improved queue management processes in place, but I just emphasise that there are multiple options for people to go and get tested, and perhaps before they leave they should search that website and see what those options are. If they arrive at a site where there is a long queue, we'll be providing them with information about alternative options. We want people to get tested. We appreciate them getting tested. We thank them for their patience, and I apologise to those who've had to wait.
In terms of people coming across the border, do you get their temperatures checked whether driving right at the airport, or is that something
Not routinely, but I might ask the Chief Health Officer to explain why.
Not everyone who gets a COVID-19 infection ever gets a temperature, so it can be quite a late symptom. So it's far, far more important that people take note of any other symptoms rather than waiting for a fever or a temperature. So we know that's not the best way of checking people. It is being done in some places, often though as a tool to remind people of the importance of saying whether or not they've got any symptoms, because whether or not you've got a temperature doesn't mean you do or don't have COVID-19.
This morning that's sick.
Coming up from Sydney at the moment, don't legally have to quarantine. What's your advice to those people who might have someone vulnerable in their city? Should they be quarantining anyway to be safe?
People should always be alert to where they've been, and anyone who's been in Greater Sydney should look at the Department of Health website for New South Wales, and they've listed where they've got all their current outbreaks. So if they've been to any of those places, it would be very sensible, as those two people did the other day, to quarantine themselves at home.
On community sport, I think there's some concerns up Toowoomba Way. There's some Logan soccer teams going up there this weekend. Are you concerned about that, or you think all community sport should proceed this weekend?
I believe that Queenslanders should proceed about their normal business as they have been. If they've got any symptoms, as always, they should stay home, they shouldn't be out and about, and they should get themselves tested. But if they're absolutely well and they're not in quarantine because they're known contact of a case, then they should do what they would normally do.
Given it was clarified the potential contact with that,
Yes. So we know this is very, very early information and it could rapidly change, but I'm just being extra cautious, and this aged care facility is also being extra cautious. So the 27-year-old gentleman who tested positive overnight, lives in Belbird Park, he has been in contact with his partner and his partner's wife, and potentially, I believe, contracted COVID-19 from one of those two individuals. Now, we don't have results on either of those individuals, but we do know that both of them attended that restaurant on the 23rd of July at the time that the first case, who came back from Melbourne, attended. So it's highly likely that one or both of those two individuals are positive for COVID-19, because we don't have other outbreaks going on in our community today. They're related to these two people and the third person who went with them down to Melbourne. Now, one of those two individuals that I believe probably has COVID-19 works at that aged care facility. So just until I find out which individual has had the infection and which individual worked there, I've asked that the aged care facility take a very, very, very cautious response, which they've immediately done. And so they've just asked all their residents to stay in their individual bedrooms. All their residents have their own bedrooms with ensuite bathrooms. So I've asked that they just do that. So they've all been given breakfast in their bedrooms this morning, for instance. So this has been ultra cautious. It doesn't mean even that one of these two wasn't the one that didn't have the infection and works there. We just have to work it all through. They're a very good aged care facility.
Sorry, is that the third person who's in quarantine but hasn't returned a positive result? But you feel they might return a positive result in the next few days?
No, sorry, this is so confusing for everyone. I do apologise. I just assure everyone we're being very cautious here. So we have a gentleman who tested positive overnight. He's our fourth case in this cluster. He has been in contact with two relatives who were at the restaurant in Sunnybank on the 23rd of July when our first case in the cluster attended.
Can you paint a picture about that moment at the restaurant, what we know about it? Because everyone worries about going to one of these restaurants. Were they there at the same time? Were they sitting next to each other with the Victorian case?
So I've only just got any of this information this morning. I'm amazed that we've got this much information at this stage. We're untangling all that. But we know that the two women who attended that restaurant were deemed to be close contacts and went into quarantine. They did absolutely the right thing. But we only knew about them after their relative had already been tested because he was unwell. So there are a lot of things going on simultaneously here, but the whole system has worked very, very well. The gentleman went and got himself tested before even knowing he was potentially a contact of a contact.
Given it was only yesterday that one of the individuals started cooperating and telling you where they'd been, why isn't there an updated list of the places that individual might have gone in the preceding 8 days?
Because they mainly stayed at home.
Do you trust that?
I do. We have excellent police who have done a really good job all through this. We know police are very good at interviewing people who don't necessarily want to tell the truth, and we've checked that with supporting information from the other travel companions. So we're pretty comfortable. But having said that, we don't know where this virus could be. So here we've got a gentleman in Melbourne Park who's suddenly popped up positive. We think we've tracked back the chain to where he's probably got it from, but that's think and belief. I don't know that. So at any point in Queensland today, we could have cases pop up. So that's why the most important message is, if you're sick, stay home and get tested. We don't have a lot of other disease out there. I think last week we had 10 cases of influenza in the entire state of Queensland. We don't have a lot of respiratory disease. So if you've got respiratory symptoms today in Queensland, there is a reasonable chance that those respiratory symptoms are due to COVID rather than due to something else. So the most important message is, don't yourself try and work out where you might have got your respiratory symptoms from. Leave that to the contact tracers. You just go and get yourself tested. And look, I do apologise for all of those queues that people are having to wait in. We're doing all our absolute best today to try and manage that better, to give a better response for people to be able to get tested. But I'm very, very grateful to the people who've come forward and managed those queues and got themselves tested.
So that individual mainly stayed at home, but that suggests that she also went somewhere else. Will there be updates about where she did go?
Of course, if we ever find anywhere that someone's been who's a confirmed case and they've been there during the period they were infectious, we will always update that. So today, the most important job for our contact tracers is to go and talk to the man who's just tested positive and find out exactly where he's been, and we'll be providing that information to everyone.
Premier, can we just get you on a couple of topics?
Yep, I have to go.
Your reaction to the news poll today, it's backed your handling of the pandemic, but it doesn't look like it's flowing through to the government support broadly.
I'm only focused on one thing at the moment, and that's keeping Queenslanders safe.
Have you had any discussions this morning about sending more support to Victoria? Talk about a national security response as well. We're hearing this from Canberra. Any update?
I don't know anything about that.
Are we sending more support to Victoria?
We will always be talking to Victoria, and where we can send support. Where we do have the resources, we are happy to look at that. And as you've seen, we have actually sent nurses down there.
Do you think your ministers need to lift their game to your effort?
Everyone is absolutely focused on dealing with this COVID response, whether that's the health response or the economic response. My cabinet is 100% united in this. There's nothing more important.
Are you worried? Clive Palmer said today that he's announcing he's going to run candidates now, and I think he's got Greg Dowling, he's recycled as his party leader. You're shaking in your boots?
Let me just say one thing about Mr. Palmer. Mr. Palmer was taking us to court to fully open up all the borders. I think that says a lot about Mr. Palmer.
He's also faces charges as well. Is that appropriate that he's sort of behind the party?
Well, that's a matter for the courts.
Yes. Two. Can you please clarify, so at the border, aside from IDs and border passes, are police requesting anything else as proof of where people are living?
Look, people do their border declaration passes, and in that they provide certain information. So what our officers do when they intercept people is verify that information through whatever means. And as we know, people have various types of identification. Now, depending on where they say they have come from, our officers will then interrogate that further. So the example with the person that came over the border early this morning at Coolangatta is the story didn't add up, and when police dug into it further, found out that she'd actually come out of Fairfield in Sydney and had put a false declaration in. So that person was fined $4,000 and turned around and sent back to Sydney for their trouble. So that's the type of process that we go to. Our officers are very good, as the Chief Health Officer said, at questioning people and working out what's going on. So that's what they're paid to do.
And do you think the process needs to change so authorities have access to flight manifests more readily? You mentioned yesterday.
Look, we get very good cooperation out of the airlines. You've got to remember the massive numbers that we're talking about here. So 8,000 passengers here today. The vast majority are doing the right thing. They all will have a border declaration pass. That we've had significant numbers of people that just make simple errors, and we work through that with them. You know, I have the figures on that, not with me, but we'd certainly capture that, and we work that through them. So we know what the error rates are, and there are very, very few who are deliberately falsifying records, and we've been managing to capture them as well.
Just one more question for the Deputy Commissioner. Are you investigating any links between these women and a crime syndicate? And there's been a suggestion that they were directed to destroy phones as well?
Yeah, I've read some of the reporting. A lot of that is complete news to me. I've not heard any of that in any of the briefings I'm getting. We've got ongoing investigations, but really they're in our normal policing space. I'm not going to comment on them any further. Thank you.
Thank you.